applied to understand the dynamics within social networks, and we'll talk about how they might be, how social networks and social media data can be applied specifically towards some instances to understand physical and mental well-being, as well as when looking at these networks, how do you identify what is credible sources within the network through some really interesting methods. And then we'll conclude with some discussion about some specific instances of safety surveillance and a software tool that's been developed by our panelist, Nabarun Dasgupta and his colleagues, and it's actually being used within the FDA currently. So each of the panelists will provide about a 20 minute overview of prepared remarks, and then we'll switch to the question and answer portion. So our first panelist is Dr. Andy Schwartz. He's an assistant professor of the Department of Computer Science at Stony Brook University. He has a doctoral degree from University of Central Florida. Then most recently, he was a postdoctoral, well, most recently before Stony Brook University, was a postdoctoral fellow at the University of Pennsylvania. He's also the lead research scientist for the World Wellbeing Project, which is a multidisciplinary group of computer scientists and psychologists who are studying physical and psychological well-being based on language and social media. He has very, very deep expertise in natural language processing, machine learning techniques, using large-scale data sets. And in 2013, he had one of the 25 most talked about research papers for personality, gender, and age in the language of social media, the open vocabulary approach. And I've seen Andy talk early this year at another forum, and so I know this is going to be an excellent session. And also, I'll go ahead and introduce Dr. Bill Rand, William Bill Rand, my colleague at the Robert H. Smith School of Business, where he's assistant professor of marketing and is also director of the Center for Complexity in Business. The Center for Complexity in Business is the first academic research center focused solely on the application of complex systems techniques to business applications and management science. So Dr. Rand has done a lot of research in the use of computational modeling techniques like agent-based modeling, GIS systems, social network analysis, and machine learning to help us analyze complex systems. And he also has an appointment with the University of Maryland Institute for Advanced Computer Studies, and several other sort of interesting experiences working with Google, doing work with National Science Foundation, working with DARPA. Oh, I don't know if I can say that. I'm just kidding. No, but it actually is working with DARPA, but I think it's okay to say that. And then finally, and certainly not least, is Dr. Nabarun Dasgupta, who's a quantitative epidemiologist who studies medicine utilization and their attendant negative consequences. He has worked with diverse groups on reducing adverse consequences of medicine use, including the World Health Organization, nonprofit organizations, local health departments in the pharmaceutical industry. He is currently Chief Science Officer at Epidemico, a health data and software firm that provides curated social media data for medical product safety, and he'll also be showing us this software during the presentation, which should be fun. And he's a member of the research faculty at the University of North Carolina at Chapel Hill. So with that, let me turn it over to Dr. Andy Schwartz.
Okay, well, thank you, Kenyon, for having me, and the FDA and MCERSI in general. Very excited to be here. I was also glad when I saw the email from MCERSI that it wasn't the other MCERSI I'm familiar with, Cersei Lannister from Game of Thrones. I might not be leaving here alive if she had invited me. This MCERSI seems much nicer. So I'm going to be talking to you about some work at the intersection of natural language processing and psychology and health. And this has really been an interdisciplinary work with, let me see if I can get rid of the bottom. Okay, there we go. Interdisciplinary work with a pretty big team, some key people here. Lyle Ungar, who is my mentor actually in computer science, Peggy Kern from psychology, Greg Park, Johannes Eichstadt, also from psychology, Raina Merchants from Penn Medicine. She runs the social media lab out of the University of Pennsylvania, and then Martin Seligman from psychology. And so I wanted to start by just paying homage to this guy, a survey, who's going to be both a friend in this presentation in that it's measures non-objective outcomes. Many of these have been developed over many decades, kind of the standard for measuring psychological factors, and especially how they relate to health. It's also a faux because it's hard to administer at scale across space, large areas of the US, or across time and multiple weeks at a time. For example, the CDC pays millions of dollars to survey people on their life satisfaction, and they just get that once a year. It's also not exactly ground truth in the end. As you're used to in medicine, a lot of these factors, behavioral, psychological factors that relate to health, aren't things you can simply measure by taking somebody's blood or looking at their genetics. And most importantly, for what I'm interested in, it's limited to preconceived theory, which is where I think really this big data comes into play, is the idea that we can do data-driven research and rigorously find patterns that come out that we didn't expect. So I'm just going to kind of skip through this quickly. The presentations earlier had a lot of social media. Everybody knows they're big. There's a lot of them. Who knows what's going to be the biggest social media in 10 years, but it's not going away. And from my perspective, the size of this data, why that's interesting, is it's the largest accessible data set of who we are. And so it's really the numbers, it's really about the people who are involved in it. And so I come from this background of natural language processing, which focuses on modeling language. And so the idea is going from that to modeling and understanding people, the people behind the language. And so it leads to some big questions. So for example, to what extent can language analyses replace and extend traditional questionnaires? This is where it could save in public health, money, and understanding things at scale. Also, can we predict disease risk and recovery from language use? Just looking at people's language, can we figure out whether they're more susceptible to a certain condition or another, or which intervention to administer? And then also, what are the psychological factors that emerge? So not just predicting, but do we see new factors coming out, emerging in the language that are predictive of a given outcome? I'll show you an example in a second of what I mean by that. This is kind of an overview of what some studies we'll talk about quickly. That basically breaks down into individual analyses where we're looking at Facebook data, 20 million messages, or community analyses where we're looking at Twitter data on the scale of about 1 billion tweets. So on the individual side, we'll use this to kind of go over the general framework that can be done for a lot of this analysis. There's usually 2 tasks, either insight or prediction. Insight is concerned really with this last question I mentioned of can we find novel things we didn't expect. Prediction is a little more focused on the goal of better being able to predict or measure an outcome. And so also working with an interdisciplinary team, we try to keep our methods pretty open and not a black box. And so the general idea is we take social media messages, we extract from them linguistic features. That just means it could just be words, counts of how often somebody mentions a word. Then we correlate that. We do some statistics. Sometimes it's as basic. It could be as basic as just Pearson correlation with the attributes of the person who wrote the message. And then we produce a visualization. So for example, this is another type of topic or type of language encoding we produce. These are topics, groups of semantically similar words. You can see here, you get a topic related at the top on dinner. You get a topic related to hospitals and pain. You get a snow kind of weather topic. And so that's kind of the idea of what we're grabbing from this data. And so if you want to, you can think of it as an encoding of who these people are. You know, you could extract and get somebody's DNA and sequence that and get an idea maybe of who they are, or you could grab their social media, extract their language and pull out some different features. These become variables just like you'd use in many analyses, and look at that like this is an encoding. Maybe not be perfect, but as I'll show you today, it's surprisingly predictive of a lot of things about people. So one of those things is gender. So we took about 75,000 users' Facebook status updates, which came out to about 20 million updates, and we looked at what language is predictive of their gender. And just to warn you, media like to run with this and say we proved that men and women are awful stereotypes of themselves. That might be a little far, but we didn't put these clouds together. This is what the data said. So this is the language that is most predictive of being female. So around the outside are topics, those groups of similar words, and in the middle are the words and phrases that are most predictive. The size of the word is its correlation strength. So for example, the less than 3 is very predictive of being female. It's also very common. On the other hand, saying mommy is also quite predictive of being female, but it's a little less common. That's what the color indicates how frequent it is. So if you've seen other word clouds, it's important to note we're visualizing something a little different here. It's not just about frequency. It's actually, these are all statistically significant predictive features here. And unfortunately, the guy's side is a little bit worse. So you get football, fighting, government, swearing. It's actually 2 government topics, kind of a government tax money topic and then a government kind of freedom type topic, and then video games. And so this is just kind of a demonstration. This is kind of what can come out here. When it comes to men and women, it maybe doesn't tell us, unfortunately, too much new information. But then we can look at things that are maybe a little less well understood. We look at extroverts. And so we can see they talk about partying. The exclamations actually, somebody uses more exclamations, the more they use, the more extroverted they are, up to 3 or up to 4 exclamations, and then it, more than 4, I don't know, that's just crazy. And then on the introverted side is my favorite, being a computer scientist. Lots of anime, the internet, computers. What came out of this, and what actually is not maybe that surprising to a computer scientist, is that introverts are into Japanese culture. Working a lot with personality psychologists on this, that was something that didn't go into this expecting. That's not really like in the literature of introvert, characterization of an introvert, is that they're going to be into that type of culture, but yet it's such a dominant part of what they're talking about and what really characterizes them. If you're not used to these symbols, they're Asian-style emoticons where you put the emoticon horizontal, so that's actually like a smiley face. And, so we can do the same thing with age. Here's, for those of you, I think everyone's probably mostly past this age, but graduating is what you could look forward to. Beers and working and napping and kind of some domestic issues, dinner tonight, business meetings. Okay, so that kind of gives you an idea of that, how you can use this data to kind of characterize and show just kind of a view, a data-driven view of what people look like, what people talk about, what they care about. But then we can also go to this question of prediction, which gets at this idea of to what extent can we replace questionnaires. We do a little bit more fancy machine learning in this case. If you're interested, contact me and I'll direct you to that. And so for the case of different personality types, this is where we got the extroversion data. This is the big 5, kind of the most prevalent personality construct in psychology. This is how well language predict somebody's personality versus a questionnaire. So you can see it does, for a social scientific variable, these are actually considered high correlations. Anything above 0.4 is considered a strong correlation. It does pretty well. And openness, for example, correlates at 0.46. If we look at how well friends can predict each other's personality, you find, well, language does actually a little bit better. So this is having friends actually take the personality questionnaire as if they were the other person and seeing what comes out of that. One thing actually particularly to note is how well openness does compared to people. That's like a construct that's actually harder for people to understand what exactly it is, and personality psychologists debate on whether it should be called openness or what it is, but the computer seems to get a little bit better grasp. And then we can ask other things like, so that's all versus a questionnaire of extroversion, but we can say how well does our language extroversion predict other variables? Well, another variable is satisfaction with life. That's measured by another questionnaire, and you see the questionnaire does quite well. Language predicts it the same way, but not quite as well. Extroversion is theorized to correlate to more with satisfaction with life. However, if you take a variable that's not measured by another questionnaire, and therefore doesn't have shared variance of the type of method you're using, you can see like number of friends, language extroversion actually predicts the number of friends you're going to have on Facebook better than the questionnaire predicts the number of friends you're going to have. And predicting gender is actually one of the things can do quite well, get close to 92%. These are this is just a random baseline on the left, and on the right, in the interest of time, I decided to leave out the middle, but across different data sets, Facebook, blog, and Twitter data sets, we get between 82 and 92% accuracy of taking somebody's language and saying they're a male or a female. And we can do the same thing with age within about 4 years of somebody's age. Okay, so that kind of gives you an idea at the individual level. Now we move on to the community level, where we're not just looking at one person. The nice thing at the community level is there's more data available. The CDC has lots of reports on county level heart disease rates, for example. And so that's what we're going to look at here. And the question is, we take Twitter tweets and we try to predict county level atherosclerotic heart disease mortality, which is one of the most prevalent types of heart disease. And we compare that then to what's down here is the US Census data that's already available at the community level, like socioeconomic information, other risk factors. And the question is, how well does Twitter compare to standard variables at predicting atherosclerotic heart disease? This is kind of the general idea of what's going on. These are all US counties on the left. This would be what the CDC reports as deaths from atherosclerotic heart disease, and then on the right will appear what our model predicts. This in particular is another data set of predicting life satisfaction, but the same idea applies. So we do some that similar statistical modeling. It's a little more complex here because we don't have as many observations. It's important to note that we are testing, we're always testing on a sample that we didn't build our model on. So we take like 4/5 of the data, we build our model on that, we hold out the other 1/5, so we haven't looked at it to make sure that we're not going to overfit. Because when you only have 1,000 observations and you have 50,000 variables, you could perfectly find a model that perfectly predicts those observations, but it won't generalize to another set of data. So then we test the model on that outside set of data and see how well does it predict on it. We do things that make it, using machine learning techniques, that make it generalize better on the on new data, but it's important to note it hasn't seen that data. And so this is what we get. So when you look at just demographics, Hispanic, married, female, percentage black within a community, you get up to just below about a 0.1 correlation with heart disease mortality. Standard risk factors, obesity, hypertension, diabetes, smoking, that's what the next 4 are. You get up to 0.2, smoking correlates 0.2 with the amount of people dying of heart disease in a community. income and education, socioeconomic factors, basically the cornerstone, predicting just above 0.2. You put all these variables into a single model and predict heart disease mortality. Now we're up to 0.35. Twitter alone, then we build our model based on Twitter, predicts significantly higher at 0.42. So what this means is Twitter is capturing more information about these communities. Remember that idea of it being an encoding of a community, more information than all of these standard factors combined. So what is it capturing, you might ask? When that's the beauty of looking at language analysis, you can actually somewhat interpret the results. So I like to think of these as quantitative results. These topics are significantly correlated with less heart disease, but they need a qualitative interpretation. And so we get topics related to higher status occupation, negative correlating with more or less heart disease, and then a lot of hate, for example, correlating with higher rates of heart disease. So communities where people are tweeting more hateful messages have higher rates of people dying from heart disease. People dying aren't necessarily the ones tweeting, but the people tweeting are representatives of their community. And by testing it out of sample data, that's how we check this. It basically says if your neighbors are angrier, you have a better chance of dying of heart disease. Not causal, but it's true. Okay, so I just wanted to end on a final study that I think is really exciting, which is at the individual level, we're now getting people's medical record and social media connected together. So we actually, the limitations of a community, what you find at the community level doesn't mean it applies at an individual level. And so we're getting there now, and we actually find 70%. We did a feasibility study of who would be willing to share their social media and their medical record for research. 70% of people who agreed to participate in a study without being told what it was, and then who said they actually use Facebook, agreed. It was much higher than we expected. We did have people, with lab coats on, and we do keep the data very secure, so that probably helps. And basically we're finding, I'm not sure what's going on here, but basically we're finding a lot of signal in this data. Just as a very first simple pass, we looked at people who have a disease mentioning terms related to the disease more, and they do significantly more. If you have an abdominal pain, you're much more likely, and you have that diagnosis, you're much more likely to talk about it a lot more. So let's go back to, and we do the same thing with mental health, predicting whether somebody has depression or not. But to kind of sum it up, bringing it back to our friend over here, hopefully you have a better idea of how social media and these analyses can take us beyond preconceived theory in terms of using social and behavioral variables to measure health outcomes. And these are just a few opportunities that I think people might consider in this space. First of all, grab social media if you can in your experiments, in your studies, from your cohorts, because you can learn so much about people. You can do personalize their devices. You can do post hoc surveys. Oh, we forgot to ask them about this. You probably can induce whatever that is from their language. You can forecast health, and then for surveillance, also, I think a lot of this morning kind of covered those types of topics. So, thank you.
All right, very interesting. How many people in here have a social media account? How many people in here would open up their social media account for research? So it's interesting, but people actually are. In the study, people actually are.
Oh, ooh, that's not the right one. Yeah, it's right here. Okay.
second one. This second, this one.
Yeah.
Okay.
Okay. There we go. Thanks.
Sure.
I think we just got it.
Okay.
Hi, everyone. So I just want to kind of follow up on a lot of what was said before. I'm not going to go into a particular research project and talk about a couple of projects at a high level, but given especially the conversations that happened during the first panel and even during the keynote, I think a lot of the problem that people are facing when looking at social media is essentially cutting through the noise. And if I'd had a chance to go back, even here I'd kind of change the title a little bit. I would have changed the title a little bit just to make it focus more on that aspect of how do we take the noise that is social media and cut through it to find the actual signal that might be underlying it. And the other thing I wanted to mention is that part of that process, I think, is a part of what data science is all about. And the word data science often gets mentioned in the space of analytics, and I wanted to bring it into this discussion because I think it's very important, right? We have this huge amount of data that's out there that has a lot of different content to it, and there's all sorts of types of data: social media, GIS, health record data, and that's an essential component of data science. But another big component is the fact that you actually use a scientific method to try and understand what that data is telling you about what's going on there, right? And finally, another aspect that came up in some of the earlier conversations is that you need to then use both the data and the science to tell a story, right? If we can't actually tell a story that convinces other people to take an action, right, then the data analytics and the analytical methods that we're using aren't that useful, right? So it's really that storytelling aspect of data science that's critically important. As Kenyon mentioned, I direct something called the Center for Complexity in Business, which is also located in the Smith School here on campus, and we really view ourselves as a data science center. That our goal is to develop new tools to help people to do data science ourselves and to also help other people conduct data science analysis on work that they want to look into, right? A lot of people have talked about how big social media is and how much is out there. I just want to quickly throw up, this is what's called the social Lumascape, and this is Luma Partners. They're a consulting company. Every year they put together all the most important players they can possibly fit on one slide to discuss what's going on in the social media space. And of course, they have all the way from the consumer on one end to like the marketer, or in the case we're talking about health surveillance, right? This is the person who might be using the social media tools and social media intelligence to understand what's going on, right? And there's just pointing out that there's a lot of different platforms in this space, right? And that there's a lot of different interesting things going on here. And moreover, as was already mentioned today, this is just the general level ones, right? This is the ones that like everyone might be involved with in some way or another, right? But then for any particular vertical, for any particular disease or for any particular area, there might be a whole nother set of additional social media platforms that might be vitally important to look into. I happen to pick, I like craft beer and making my own beer, so not necessarily relevant to the health community, except for maybe for studying liver disease, but the ones that I look at, for instance, there's ones like within the craft beer industry, there's at least 4 social media platforms with heavily active user bases that are not on Twitter or Facebook. Well, they're not probably there as well, but they're also located in a completely separate regime, right? So Pintly, Beer Advocate, Rate Beer, and Untapped, right? And so really, if you want to get down and understand the signal and not just the noise, right, one thing you can start to do is drill down to these more specific communities, right? Now, even once you've done that, right, you still have to cut through this noise. You have to look through all the different opportunities that you have out there and all the different noise that's there and really pay attention to what's the important conversations that are happening in that space. One way you could do that would be to start to try and identify the most influential users in that space, right? To try and find the people who are likely to convince other people about what they're saying, right? They're the ones who are going to sway that conversation, steer public opinion, and change what's going on within that. And we've done some research, and one of the standard kind of approaches in this space is to kind of look at who has the most friends, right? And who has the most followers on social media. But it turns out that a lot of times, if you're really interested in how quickly a message is going to spread through social media, that's not necessarily the biggest focus of interest. Because a lot of people who have a lot of friends and a lot of followers on social media are also talking to lots of the same other people, right? They're talking to other people with lots of friends and lots of followers on social media. So that constrains social contagion to some extent to those very popular groups within the overall space. Often what you want to find is actually people who have lots of friends, but whose friends don't know each other, right? You want to find the bridging people within social media, the people who sit between different regimes. So maybe you have the people who are, talking to the stay-at-home moms about what the policies they should use to educate their children about immunization, but also to educators within the administrators within the educational system, right? And that people there might have a bigger influence on what's happening within the overall adoption of immunization policies and things like that than someone who just has a lot of friends in general within that topic area. Besides influence, one thing we found, and a lot of influence measures are based purely upon structural notions of social media, like who's connected to whom, who's looking at whom, how are those systems set up, who talks the most often. What we've found in a lot of our research is that another aspect that's often overlooked is trust, right? So even if someone's talking all the time, and in like maybe some presidential candidates, they might not be trusted by anyone, right? They might not be supported in terms of their views. And so as a result, they're not going to listen to what they actually have to say, right? A much better way to measure the amount of influence that an individual has on their social media community is to instead monitor them over time and see who's actually adopting the things that person is saying, right? Who's actually agreeing with them in one way or another. And we did some studies using dig.com data where we showed that, in fact, that was a much, much better of virality and of influence within an overall social media network than anything that you could use from a pure structural property notion, right? So if you were just looking at who has the most friends, that a person with less friends but with more trust had more impact on the network over time than the person with lots of friends, right? So really diving into these networks, analyzing who's actually reacting to the conversations, who's looking at those conversations, can give you a better indication of what the actual signal of the information within that system is going to be about. We've also explored a bunch of different other methods of looking at identification, right? So you can look at kind of these pure structural notions like who's connected to whom and who's talking to whom, or who's creating a lot of volume on Twitter, or who's creating a lot of messaging on Facebook. And you can see, is that going to be important for what I want in terms of understanding how people are discussing topics on social media? You could look at things like how often have they created buzz in the past, a particular individual. And in this case, we took a data set that was drawn from Hurricane Sandy, Superstorm Sandy, and we tried to predict who was likely to cause retweets in the future based upon the data we had up until that point, right? So we start with we start 2 days before landfall, and we start to look at who's causing conversations about the superstorm, right? And then we look and we try and predict a day ahead of time. And then we look another day and we try and predict a day ahead of time. And look another day and we try and predict a day ahead of time. And what we found in the end, there was a lot of times the best indicator that we could come up with of how to predict who is likely to have a lot of influence on the conversations and who's going to steer the conversations was using the dynamics of the network over time rather than any particular static one shot that we had of the conversations, right? So in other words, who's joining conversations and then and then joining another conversation, then joining another conversation, rather than someone who just seems to be amassing one coalition of individuals talking about a particular topic, right? And why would you want to know that from a health surveillance standpoint? Well, you want to know that because those are the people you should probably be paying attention to, because they're the ones who are going to be talking about things that everyone else is talking about a week or 2 weeks or even a month from now, right? They're the people who really give you insight into where the social media conversation on a particular topic is going. So they provide a signal that helps you move away from the noise of what's happening. We've spent some time also just looking at trends on social media, and one thing that I think is often overlooked is that you can, by following social media over time, start to disentangle what is something that changes constantly and what is something that stays the same. And we asked the question, the title of this paper I love is because does love change on Twitter, right? And it was the idea that in fact the conversations that you saw about things like economy, jobs, fun, music, love, war, these kind of big picture questions, the kinds of ways people talk about them, they don't change very often, right? So if all of a sudden within one of those notions you saw wild fluctuations in the conversations, that would be a clear signal that something was going on in that, right? And so you could use that kind of baseline reading of how often the conversations change to adjudicate whether or not there was an interesting trend within this data that you needed to look at, right? On the other hand, if you looked at things like the world economy, baseball, the London riots, the study's getting a little dated at this point, the government and global warming, these things changed constantly, right? And so saying that all of a sudden there was a spike in conversations about global warming does not mean that all of a sudden lots of people are interested in global warming. It's the way the languages change and evolve over time that say that that's going to happen naturally. And it's only by studying the variance of those trends over time that you really start to grasp with what is the signal and what is the noise within the social media data. Just to give you another example and to tie into the next study, you also have to pay attention to geography, right? Certain geographies talk about topics in different ways than other geographies do. So this again goes back to some of the Superstorm Sandy data. And in this case, we took the data and we split conversations that happened within 10 miles of New York City and conversations that didn't happen within 10 miles of New York City. And what we found is that people were talking about very different things in those spaces. And if you mush this all together, you don't get nearly as much insight into what's happening in these conversations as when you pull them apart. So people near New York City are talking a lot about the concerns over food and water, right? And the fact that there isn't food and water there. People away from New York City are talking about rain piling all over the place and flooding and wind damage and things like that. And so the way you would actually react to these situations might be very different if you were concerned about people in one locality versus another. And when you combine those two together, you lose a lot of the signal in the middle of the noise as to what's going on. And in fact, you can start to use this to build geographically based models of where social media contacts are coming from. So in that particular, in the previous data, we just looked at just those geotagged tweets. But it turns out that geotagged tweets are actually a very small proportion of the overall social media data. So for a large portion, you don't actually know where people are coming from. But there's new techniques on the horizon, such as using user-described geography of where they say they are, or by using a term called ambient geography, which means inferring their geographic location from other words they might mention, right? Like if they mention they're at Times Square, that kind of gives you some insight into where they might be possibly within the world. And then once you have that, you can garner new insight into where that particular health problem or issue or anything like that is really going on. You can also start to infer signal from noise, because if they're closer to a particular locality that they're discussing, chances are they're being more truthful. There's been a lot of studies in the past that have shown that, right? And so they might have a better understanding what's actually happening within that system. Just to give you an example, one particular company is taking this to heart, and many of you may have seen the Sick Weather app already, but that picture on the bottom right is in fact the Sick Weather app, where they're taking tweets and they're starting to build maps of where there's different diseases spreading. For instance, and mainly stuff like the cold and the flu and stuff like that along those lines. Right? So, I think there's a lot of challenges to using social media and to separating the signal from the noise, but I think that there's a lot of opportunities as well, right? We need better methods to automatically assess the quality and impact of social media content. And I think things like trust, influence, location detection, baseline readings of trending topics can help you do a lot of that. I also think that the failure of things like Google Flu Trends, which many people was touted as this big success and then starts over and under predicting by orders of magnitude the actual flu, indicates that the solution is not in big data, which is unguided by theory, right? We need to guide big data analysis, and Gordon did a good job of talking about this earlier, by the theory of what's going on within that system whatsoever. And just to throw up my favorite of the various spurious correlations, by the way, that's the divorce rate in Maine, which is correlated at 0.99 ratio with the per capita consumption of margarine in the United States, right? And I don't think I want to have anyone come up with a particular explanation for that. Over a solid decade, by the way. And so it's pretty amazing within that. So we need to start taking theory and helping it to guide some of this analysis and helping it guide some of this explanation, right? And some of the trust and influence measures allow us to kind of pair through that and find the most important pieces of information that might be there. There's also, of course, and I'm not going to talk about this today, but we'll talk about this in other cases. There's a selection bias in terms of those who use social media to talk about health. And we need to account for that bias. And one of my colleagues at the business school, Wendy Moe, has done some great work showing how if you take into account multiple social media venues simultaneously, you can usually put those together to build an ensemble prediction that's better than any of the one particular platforms by itself. Essentially, uncovering the bias by looking at the biases that are present in those different platforms and using them together. On the opportunity side, I think that there's a lot of these tools and a lot of these platforms we're only going to have more resolution as time goes on, right? We're only going to have more data, right? Which means that we're going to have more insight and more ways to account for the particular biases that might exist within this system. And that's going to be made possible by the fact that we have new methods for filtering and doing content analysis within this overall space. And I would argue that really the key is going to be combining multiple signals into one solid signal of prediction together, rather than looking at any of these individual signals by the end. In the end, we just need to cut through the noise to the end. So thanks.
That was great. Thank you, Bill. And let me ask Dr. Navarone to come to the podium.
I realize I'm between you and your weekend, so we'll make this go fast. The slides are on Twitter already, so feel free to use them for whatever you want. I had a disclosure slide in here, but I don't know where it went. Okay. Sorry, there we go. Slightly out of order. So I want to acknowledge that this research has been funded by the US FDA, but also MHRA, which is the UK regulatory body, and our industry development partner is GSK. So we are commercializing aspects of this research, as you have heard. In a very quick 20 minutes, I'm going to show you 6 specific examples of how companies and government are already using social media, using the tools that we've developed. But first, I want to give you a quick rundown on how we tame social media data, okay? So if I start taking a new medicine, this is what I usually do. And I learn something from seeing what other people are doing. But if I'm in a position where I need to monitor a drug professionally, doing a search on Twitter is not going to make a reproducible, auditable, responsible way to look at the information. So we decided to build some tools that might help us get there. So the data process overview, and this will look very familiar to the things that the other presenters have shown us, but we ingest massive amounts of data from different social media sources. We can talk about what the right social media source is for the right disease condition, but some of these are through third-party authorized data vendors from the social media sources themselves, and also like hammering out DUAs with individual website owners, some of whom happen to be in Russia or Australia or wherever else. So it's a lot of fun. So we acquire the data. The fonts didn't quite make it. So first step is acquire. The second step is filter. So we use automated processes to identify events that are important to us, and then we clean the data. I apologize for the fonts not converting well to a PC. The third step is data curation, and this is a human process that we use to remove false positives, and it's something that's optional, and I'll show you kind of how that works out in just a moment. The fourth step is statistics, and this is really hypothesis generation. A lot of this is visualization and things like that. But I think, as Dr. Gao pointed out, I think causation and really getting to causal inference is something that's a synthesis of information where we layer data from other sources in. And I'll show you a couple examples of that. Okay, this is what your inbox looks like. You get about 12,000 emails a year, and of those, only about a quarter of them actually show up in your inbox. Everything is in the spam filter. We thought, okay, cool, let's make a better spam filter that can read social media data, but only find the adverse events or find whatever else is important to us. So that's what the basic classifier uses the same exact infrastructure and equations as your email filters. So we've trained the classifier using machine learning techniques to identify which posts look like adverse events for drugs. For drugs, vaccines, medical devices, tobacco products, cosmetics, and a few other classes of product. So how do we process the data? So this is big data, analytics, all that going into one unified system. So the first is to identify the posts of interest. So we use the natural language processing and the machine learning classifier that looks like a spam filter. We then translate what is being said by people on Twitter or Facebook or whatever social media site, translate the internet vernacular using a dictionary into a medical ontology. So MEDRA is similar to ICD or SNOMED and other things like that. So we have a dictionary, which I'll show you in just a moment, which translates the terms. The next step is to consolidate multiple posts across different social media sources, multiple posts by the same user. There's different ways to do that. And then we also spend a lot of time removing personally identifiable information. So part of the reason why pharmaceutical companies can use our system, which is GXP validated and has the software validation to it, is because we're removing the identifiable information from each post, so each post doesn't trigger an automatic reporting requirement. Okay. And then finally, we geotag the post using some of the inferential geography tools that were just mentioned. So here's so when you listen and look at internet data, it's very noisy. You see all kinds of language. It's hard to make sense of it. So we built a dictionary that takes typos into account, spelling variations between the British way of spelling things and the correct way of spelling things. We have combined and invented words, especially in the form of hashtags. Also, if you're a German speaker, you're used to this problem. And implied phrases, like this is not a murine infection or anything, but is really the beauty and the nature and kind of the loveliness of the English language. And we want to take some of that into account. So the dictionary would take those phrases and then correctly classify them to the right MEDRA ontology. So we can use ICD, we can use SNOMED, we can use other tools. And I know there's some ontology questions, and we can talk more details about how this works in the future. So you saw this already. So if you put all of that together, we strip out the PII, but hold on to some identifying information. We identify the product, identify the location, the time, and then convert that to a MEDRA code. We call these proto-AEs, posts with resemblance to adverse events, to again kind of differentiate it from identifiable adverse events that would trigger reporting requirements. Okay, how well does the system work? Well, to give you kind of a sense of scale, there's about 60 million posts mentioning medical products in the system right now. 380,000 of them have been manually reviewed by individuals on our team who are certified MEDRA coders. So, each time you hit the report a spam button on your email, that's basically what these people have done 380,000 times, God bless them, to train the classifier. Okay. Putting it all together, how does it work? Precision, also called positive predictive value for the epidemiologist, is about 68%. So some noise does come through, and sensitivity is higher at 88%. So it's decent. In order to, and I think, I can't remember who it was maybe Isaac who was mentioning it, that we need to do things that reduce the noise as well as bring up the signal. So one way to do that is if we manually curate, we can increase the precision to be higher by manually eliminating some of the false positives, train the classifier to do it better next time. we've had a lot of support from public government agencies and an appreciation for public investment in these tools. We are putting together an API which will package these different taxonomy pieces and allow anybody to run these tools on their own data. So we just got the first version stood up last week, so bear with us until we get that working. Okay, let me give you the quick examples, okay? So this is a project that we are doing for the Office of International Programs at FDA. Is anybody here from OIP? I don't see anyone. Okay, cool. So what happens, OIP came to us and asked us to monitor Chinese social media for possible safety concerns related to food and drugs that are being exported to the United States. This sounds far-fetched, right? How could this possibly work? Well, it turns out if you look at Baidu and Weibo and other Chinese media sources, you actually can train a classifier to identify the posts in Mandarin or Cantonese on that are food and contaminant, adulterant, counterfeit related. So the system is designed to do that. It operates on a 24/7 basis. And you can see some of the visualizations here. Very simple and easy to understand if you can see them. But the other thing that's important is that we can layer in environmental data. So if we're looking at a food-based contamination or a drought or something like that, we can have the environmental weather data and transportation links and hubs also layered in there. The other really cool thing is that we've been able to map out using Duns and Bradstreet data and other types of business relationship data that kind of linking a product. So we get a post on social media says this product is contaminated in Chinese, in the Chinese social media. We can then say, okay, here are the producers that likely led to the product that's being talked about, and these are the likely distributors in the United States. So we can quickly pinpoint where inspections might be better used. So an example of that, does anybody know what gutter oil is? That's good. Gutter oil is a combination of food waste, animal offal, and leather tannery effluents. Okay, it's pretty disgusting. It's also called, there's other names for it, but I like gutter oil. So the story broke in Chinese social media. We picked it up, and OIP actually investigated and found that company, so the company whose name was associated was registered in the Cayman Islands. And tracing this back, they were able to, OIP at FDA was able to identify other regulatory problems that company had, saying, enough to say like, okay, this might be a real thing, right? This is where causation and layering data starts to make more sense than just looking at the data. And then we were able to then go upstream and say, who are the upstream distributors who may have provided the contaminated product, and who are they distributing to? And we were able to actually quantify some of those. So very quickly, we were able to kind of paint a more holistic picture of the distribution channel, and OIP was able to warn the correct stakeholders accordingly. We also get a lot of there's examples of counterfeit products being described and discussed. On the left is the fake product, and on the right is GSK's actual branded product. And you can see this particular user was tipped off by how cheap it was. Okay, so moving from supply chain into the clinical data sphere, clinical trials is another place where we're helping companies look at clinical social media data about their clinical trials, specifically around unblinding and dropout. Okay, these are real data from on specific trials. I'm in this double-blind trial. Here's the trial number. I'm not seeing any benefit from this medicine I've been given. I'm going to bail from the study. And it's not just the individuals in the study who are talking about it. People whose relatives are in the study are also talking about it. Sounds like your father may have been on the real thing, but I doubt my brother is. He might be on the placebo. I can't see any reason why people should continue. Okay. You also see kind of sophisticated discussion about placebos. I took no flavor to mean that he's on placebo. Just wondering else if anyone else is enteric coded. Okay, so these are specific trials that are being talked about. So we can go back. So the company that's running the trials and the companies that are running the trials can go back and start talking. Start understanding what the effect of blinding is on the validity of the trial. Okay, I'll give you a quick example of now in spontaneous report post-marketing, and this is a real-world example, so how social data can help spontaneous data. So we have a company that does routine portfolio surveillance for a handful of their products and drug products. And there was a particular post that was identified in Twitter using our system, which had the construct of, did this product cause XYZ, question mark. I've had 3 administrations of this product, and ever since then have felt ABC. That the company then looked back at their spontaneous report database and actually found a couple of cases that had been received about the same association, but had not reached the level of signaling. So the company hadn't identified it as a particular concern already. So this is a false negative that's being looked at here. And then that finally was analyzed well enough to be reported to the regulator and may lead to some labeling actions. So this is a real-world example that has actually happened, and this is being reviewed right now by the by a regulator. Okay, so we've touched a little bit about geography and time, and putting some of the tools that have been mentioned together, some of the geography tools and other pieces. I want to show you just very quickly kind of what it takes to do an analysis of this level. So we were looking at direct-to-consumer advertising and whether social media whether we can see increases in adverse events reported in social media because of that. It was a longer analysis, but to give you an idea, we over an 18-month period, we started with 1.2 million posts. About 67% of that was spam and news and coupons and junk. So it gives you an idea of magnitude. We selected only English language for this particular analysis. About 35% were duplicates that were retweets, reposts, things like that. Got rid of those. We identified those with adverse events and kept only the ones from US, UK, Canada, and Australia for this study. Not exactly relevant to this right now. We actually found identifiable geography in 55% of proto-AEs that we were finding in Twitter. And I think that's because we were using layered inferential geographic identifiers. And so we went from 1.2 million posts down to about 4,500 posts of actual analysis. And we were able to automate this whole stack. So here's a map of where adverse events for these drugs are being reported by hour in the United States. So you can see LA and the and Northeast are lighting up. But this starts to give us, you're not going to see a whole lot of patterns here. It's just interesting to see that we can do it. But if you look at the data and break it down, so these are, I think, 38 of the different products that we looked at. You can see the spark lines over a 24-hour period starting at midnight. But you can also see if you aggregate those data that this peak at 10:15 to 10:30, 10 to 10:15, had the most proto-AEs being reported. And I know what you're thinking, dude, that's totally spurious. There's no way that can mean anything. This is social media doing a weird thing. Maybe it has to do with when things are being advertised. Okay, that's totally legit criticism, okay? And then we started looking at the literature. So the majority of postings about migraine occurred peaking on weekdays at 10 a.m. and then gradually in the evening. And then we looked at literature from intensive care units, and they're saying that most AEs occurred between 8 and 12 a.m. with a peak around 10 a.m. So we're starting to bring in other, we see a correlation that may be totally spurious, who knows, but by looking at other literature, we're trying to understand. And these are the types of questions that we can ask where we don't usually ask about time of day, but it makes a big difference in the quality of life for an individual patient. Can we quantify patient benefit? This is a poster that was presented by GSK at the ISPOR conference recently, but the answer is basically yes. Of the 15 GSK products they were looking at, there was information on benefits to the patient in about I think it's about 30% of the adverse events. So people are saying this bad thing happened, but it also was helping me. So when we start talking about quantifying benefit risk, we can find, this is a way we can start actually putting numbers to it. Okay, we will now quickly move to the demo and hope this works. Does anybody know how to use a PC?
I used to, not anymore. That's fine. Here, just pop up. There you go.
Awesome, thank you. Okay. Oh, great. Okay. So this is an open public demo that you can look at online. Albuterol is the drug we're looking at. It's an asthma medication. This is the interface. So you have the timeline. You can see the number, and this is by week, so you can see kind of how many posts are being that are proto-Es in Facebook and Twitter and patient forums. This gives you an idea of the actual posts and the level of information. So we strip out identifying information, kind of leave just the individual pieces. You can see as we scroll down, you can see kind of in green and blue, in green are the different drugs that are being used, and in yellow are the verbatim language that gets mapped to the proto-AEs. You can request reclassification of these if you don't agree with a particular thing that the classifier has done. The Facebook posts are a lot longer than the Twitter posts are, and you can see some examples right here. You can also see some of the gender-based gender identification tools, and we actually use some of your work in informing how we develop that tool. So, thanks. You can look for serious adverse events. You can export the data to Excel, or you can run a set of filters. So one of the ways we find posts that are of more salience is looking for health system interaction. So let me just pause that for a second. So health system interaction. So if a post says I had to go to the doctor, I had to go to the emergency room, my pharmacist changed my dose, that kind of gives it a level of credibility to us that is a quick way to sort through a lot of social data. We find between 5 and 10% of the proto-AEs have some sort of health indication, health system interaction. You can also use that as a starting point for investigation if you wanted to do follow-up, say. Built into the software are also different hierarchies, so the anatomical therapeutic classes of medications. The measure hierarchy is in here. These are ontologies for adverse events, so you can choose which ones you're looking at, and there's clusters of these codes that are available as well. You can save the filters. You can share them with your colleagues, and there's a few kind of preset views that you can look at. If I did it right. Okay, there we go. So for example, looking at the geography, I showed you kind of the analysis map, but you can also look at it in real time. And so it's a little bit more data. So you click on it, it gives you some of the characteristics of the different posts. We do a trick to truncate the latitude longitude so that it's not identifiable. So we'll truncate the last few digits, because you could be able to otherwise identify people's homes. So we truncate the last few digits, add fake ones, and create enough noise in the system to hide it within in a reasonable time place. This view, sorry, let me pause this again. Okay. Sorry, I forgot how to use these machines. Okay, so this is if you want more quantitative breakdown of what the numbers say, you can look at it from this view. If you're familiar with albuterol, these are very common side effects that are well known: tremor, jitteriness, malaise, hypersensitivities, insomnia. So there's a lot of, and this is all automated. No human has touched these data from after it was sent from the person's phone. So kind of in an automated way, we can really start looking at some of these information. And I think that's pretty much all the important pieces. Oh, yeah, no, sorry. The most important piece, or one of the most important pieces, using OpenFDA, we can then compare what we're seeing in the social data with what's in FAIRS, kind of on in an automated way. So we can look at it at the preferred term, which is a more granular level, but we can also look at it at a system organ class level as well, which I will do by magic right now without touching the software. Okay, so that should be it. But we are. Okay. We are almost done. There are limitations that are worth mentioning, and a lot of these have been touched upon. So causality and veracity. So increasingly, we get questions about, can the system be gamed? Can you put in false adverse event reports? And of course, you can do that in FAIRS. You can do it anywhere along the chain, but social media may be more pliant to this type of thing. I think that's the best timer I've heard for finishing up. Have more of that. The volume is large. There's some other concerns, but whatever. These are the people who actually make the software work, and I'm incredibly grateful for their help. And feel free to come visit us in Boston. This is the background on my desktop at home, and from one of my favorite illustrators, Edward Gorey. And I think it's important to remember that the stuff, it looks cool. It's also got a ability to disappear. So let's see, let's come together and figure out how we can trust and what we can trust. Thank you.
Thank you very much, Nab. So we're getting close to time, but we will take one or two questions, and I'll ask Dr. Agrawal to come up to the stage while we're taking those questions for a couple closing remarks. So does anyone have any questions from the last panel? Please, over there.
Thank you so much, guys, for this amazing presentation. I have one question regarding social media. Like, you take a lot of social media messages, especially Twitter, and you get a lot of noise and signal. So I have a case where, like, Ebola is spreading, and celebrity tweets that I'm hurt, hashtag Ebola. And of course, after that, 90,000 people will retweet that. Among those 90,000, how will you extract the exact tweet which is related to Ebola? Like, somebody is actually hurt through Ebola, and that person tweets, I'm not feeling well, hashtag Ebola. So that is a big issue when 90,000 tweets may be a noise to you guys, and one tweet which is very important to exactly find the location of the patient.
Yep, so that's a great question. And so the tool we built for Ebola surveillance in social data is at healthmap.org/Ebola, and you can see kind of the way we do it. But we classify the index posts. We also classify kind of there's an alerting system that's based on a whole bunch of things like number of followers, number of retweets, and things like that. So it's a matter of kind of using the same logic as you would in case contact tracing in an outbreak and finding the initial post. We also use a geo layer on it, but I think a lot of the tools that have been talked about can be used in succession to find it.
Yeah, I would say that I think there's also some work to be done in terms of improving some of these methods. We've been looking at maybe using some of the methods from investigative journalism and information forensics to kind of even make this even better. Like, and one of the ones I mentioned is, the closer you are to a particular location where there was a previous reported case of Ebola, right, means that there's a higher credibility that that's a person who might actually have Ebola, right? So how do you actually determine how credible that particular report is, right? And you can also use imagery, right? So a lot of these posts actually have images attached to them. So you can try and determine if that image makes sense within the context of where it claims to be coming from, things like that I think would be sophisticated. That's still ongoing research. I don't think anyone's built all those tools together yet, but I think there's some cool stuff you can do in that space.
I know with like Ebola, there was an example of the visualization where there was a quarantine, there was a ban on fishing, and you could actually see satellite images of boats going out on a regular day, and then the ban being put in place, and all the boats being docked, and it was a way to measure the effectiveness of risk reducing measure.
More advanced NLP can also help with that, and that's the way a lot of these surveillance systems are going. The Google Flu Trends, there's actually a group at Hopkins that has a more accurate system now, and they're just understanding the language a lot better. Is somebody talking about a symptom, or are they just talking about it in general, or are they talking about themselves or not?
So my question to Andrew is that are you doing some research about how to sign up people so that they can disclose their social media data? So what are the tricks to make them enroll in the research? Thanks.
Only a little bit of anecdotal, really, research. We started out, we were getting more males signing up, and we thought it was because we had a female who was our initial person doing the signups. But then that turned out not to be true. In the end, we ended up with a little bit more females signed up, and we tried to look at like the characteristics of the interns that were enrolling patients, and didn't find anything particularly significant. But I could say, we had these were people wearing a white coat. It said Penn Medicine on them. They made certain assurances. I would assume that made a pretty big difference.
And just to piggyback on that, one of our collaborators is doing the same thing in the United Kingdom, and what they have there is a community, a geographic town, that has agreed to pool its electronic health records for research purposes. And as part of that, they were able to get an opt-out policy for connecting the social data. So that was a little bit more heavy-handed, but.
I mentioned briefly before the talk, we actually did a little bit of a prototype with trying to search for symptoms within the College Park area for the School for Public Health, which with the idea of actually generating a subject list from that. So then you could reach out directly over social media to individuals who are indicating that they had symptoms. So it's kind of like it's a selection bias, right? Because you're saying, I'm going to find people who are talking about disease symptom conditions, and then I'm going to reach out to them and try and recruit them. But that was one thing we were looking into. Never kind of got past the prototype stage, but it seemed to be working moderately well in the prototype.
I should add one more point. We've done some online recruiting, and there it helps a lot if you give the volunteer something back. So maybe it's we're working on developing more of this now, but maybe it's a fun prediction of their personality, or something that helps them spread it. But I don't, that's not as sensitive information as your medical records.
Any other questions for the panelists? Hearing none, it's my pleasure then to, well, first, let's get another round of applause.